Hello, I'm Dr. Foojan Zeine, and welcome to another episode of Inner Voice Show, where we talk about what's most important in your life with experts, with people who have experienced it themselves, or they are an expert in the field that is very, very close to your heart. So today, I'm honored and I'm very excited to have Szabo, who is the founder and CEO of Human Power Project, with us. And we're going to talk about a couple of different things. One, maybe his own experience with some of the aspects of mental health and bipolar depression, and what he has for us in the future, which is very, very important, not only to your life, but I think everybody in the world because of mental health. Because obviously, I'm a therapist, and I think that first and most, we need our mental aspects healthy before we can have anything else in our life healthy. So thank you for coming and joining me in our program.
Thank you so much for having me. It's great to be here.
Of course. Ross, you've done a lot of work, not only with yourself, but with the community. You have created an amazing experience from within and then turned it into your passion and what can be passionate for the rest of the world, and what people can learn and bring into their life to make themselves healthy. And to me, I know that when I've worked for 25 years with people, and when I even went to school because I wanted to work on myself and look at what works for me, and when I've have personal experience in some area that is so close to our heart, and we're so passionate about it, that it, kind of like raises from our heart and lands on the others. Yeah. And we just kind of like add knowledge to it, yes. Right? Mm-hmm. So tell me about your experience and what brought up this passion to take what you have and give it to the rest of the world.
Well, thanks. Yeah, I often joke with people that you don't become a mental health advocate or someone who works in the mental health field because you had this perfect life, right?
Exactly.
You don't get there by not having some challenges, right? And so I visited my brother in a psychiatric ward when I was 11. He was diagnosed with bipolar disorder. He was 18 at the time. And that was kind of the introduction for my family, where we had a close, family member, my brother, who was hospitalized while he was in college. And so that was kind of my introduction to seeing bipolar disorder. Then I was diagnosed with bipolar disorder when I was 16. And then at age 17, my diagnosis changed to bipolar disorder with anger control problems and psychotic features. And so as a teenager, I was already going through kind of the big changes with bipolar disorder, the manic highs where I couldn't sleep for more than an hour a night for a week at a time, the depression, the anger, and then I started having hallucinations and delusions, and that led me into my senior year of high school. And in my senior year of high school, I was actually hospitalized for attempting to take my own life. I wasn't on anyone's radar when that happened. I was a class president and involved in every student activity possible and had great grades and was volunteering, but depression, just doesn't care about that stuff. Right. And I hid it for way too long, and by the time it came out in me wanting to take my own life. When I got out of that hospital, I went back to high school, and when I went back, everything had changed. I lost friends, and I had rumors about me, and I had people just saying really terrible things. And 2 months after I got out of that hospital, a psychologist came into one of my classrooms to talk about just patients he was treating. And as he talked about those patients, every single student in the class started laughing. And I got really angry, and I grabbed my teacher, and I took him into the hallway, and I said, this isn't something people should laugh about.
Right.
And he looked down at me and he said, well, what are you going to do about it? And I said, let me speak. Let me tell people what it's like to go through these things. So that was kind of my call to action, was I started speaking about it pretty shortly after I was diagnosed with bipolar disorder. And then I went through years of much worse times, of more mania, more depression. I was in and out of college for 4 years. I had a horrible, horrible alcohol abuse issue. And it took about 5 years before I was able to really stabilize myself and start balancing and then actually start working on the bipolar disorder. I would say from age 16 to like age 21, it was managing my life. It was controlling my life. It was dictating everything I could or could not do. And then after age 21, I started to fight back and was able to start finding things and just different components that could help me manage it or balance it.
I know that working with many clients right now, the aspect of bipolar and addiction many times comes side to side. And it's almost like, is it the chicken or the egg, and
Right.
maybe the both. I know that many people have been diagnosed and have maybe like a hereditary concept of genetic coming from their family. And therefore, they self-medicate in one way or another and go into addiction. And then the added chemical that is going into our body kind of disturbs the already maybe imbalances that are there. And then on the other side, we also have a lot of teens who start drug use very early on, just because of the drug use itself, and then using of daily use of some sort of a drug then changes the chemistry of their body. And
Right.
now we're finding a lot of people who are going through recovery are also getting diagnosed by bipolar because something has changed the chemistry of their body, and they're going through the the duality of the episodes from one manic or depressions, or bipolar 2, which is hypomanic and going through a lot of depression, and then kind of more the anxiety and the anger that comes. I know that you have worked a lot with other people and in your speaking engagements talked about bipolar. What is your experience between talking to people about the bipolar and addiction itself?
So for me, like, I came from a family that has mental illness, alcoholism, addiction, and other issues on both sides. So it's, in terms of like a biological component, there was alcoholism on both sides of my mom and my dad's family. And then there was also depression, bipolar disorder, and anxiety. So for me, I was kind of like a biological ticking time bomb in a sense, where if I had a certain trigger, I always joke with people like, it wasn't if it was going to be something, it was what was it going to be. If you spun the wheel, was it going to be bipolar? Was it going to be anxiety? Was it going to be depression? Was it going to be alcoholism? You could take your pick. For me, I just used alcohol really as a coping mechanism. When I was thinking 8 to 9 thoughts every minute as I was trying to go to sleep at night, or when I was feeling so depressed and had so much self-hatred and so much loneliness, I was drinking alcohol as a coping mechanism. I never was an alcoholic, and I never had the addiction principles of it, and I never had the withdrawal, I never had the shakes, those kind of more symptoms associated with addiction. For me, it was really just a way to shut my mind down. It was a quick fix. It was a way to escape. It was a way for me to just get out of whatever I was doing. And so my path to balancing it was replacing that coping mechanism with things that were more healthy. But even to this day, I'm able to drink socially. I don't have the addiction principles with alcohol that some of my family members have had, and some other people have in co-occurrence with bipolar disorder.
Working with a lot of bipolar clients, I know that one of the aspects that they suffer a lot, and as my compassion with them, I suffer with them in a sense, is in the depth of depression, which you also said is sometimes we just want to commit suicide. And then the other side of it is the way that they're thinking is, this is something that's going to be there for the rest of my life. I have to go through these cycles for the rest of my life, and there is no cure for it. So why should I put myself into this suffering? And it almost becomes a time game where you can just hold on through the cycle and hang in there until we shift to the next level.
Yeah.
So what would you say to them? Going from different cycles, what does someone have to hold on to until they go through the cycle?
I think that in my darkest times, and I talk to a lot of people who have gone through this too, when you don't want to live for yourself, finding someone else or something else to live for until you get through that period. Eventually, no matter who you are, you want to find reasons to live for yourself, not in a selfish way. But if you're constantly living your life for other people, whether it's a kid or a sibling or a loved one, it's not enough to sustain you. It's not enough to always hold you up during those dark times. And so I think it's okay to use those things intermittently, but eventually you want to find a way to live for yourself. And I think also it is remembering that, suicide is a permanent solution to a temporary situation. Depression does ebb and flow. It does change. And I think the most important thing is, even in those time periods where I had no energy, where I had no willingness to want to get out of my mood, to do anything, I had support, where people were like, you're just going to go and watch a movie today. You're just going to go and do something. You can't just keep sitting here in this depression and letting it get worse and worse and worse and worse, because the deeper you go, the harder it is to come out. And sometimes when you're in a state of horrible depression, you might not even feel like you have the energy to get off the couch or to get out of bed, but it's really important to try and do those things, because if you don't, you're going to go further into that depression, and you're going to, I always talk about creating neural pathways in your brain, and the more often you use neural pathways, the more automatic that behavior becomes. And if you're just using your neural pathways in a way that's absorbed by that depression and you're not breaking it in any way, it gets so much worse before you can come out of it.
So one of the ways to break that cycle of depression is, as you said, one is activity, like getting up and actually forcing yourself on a schedule to do some sort of an activity on a habitual form, so that you create a whole new way of a habit that is sequential and it has time frames, so that your body can get used to that. And that's how you build the neural networks of your brain into completely something new. Therefore, it becomes automatic. Yeah. What else would you suggest?
I think what's tough with depression is a lot of times, especially recently, you want people to talk about how they feel. There were a lot of times during my darkest depressions where talking about it didn't help. It almost reinforced it, where, if you're so empty, where you feel like you're going to take your own life, where you're constantly feeling about death and suicide, it's important to get it out in some way, but constantly talking about it just kind of made it worse for me.
Yes.
And so I think in those experiences, it's good to have a connection to something larger than yourself. For me, that was just volunteering. That was seeing other people doing other things.
Like getting out of yourself.
Right. And some people that's religion, and some people that's family, and some people that's, whatever it is. But having something that shows you that there is more to this life than just you is really important, because depression tricks you.
Yeah.
In some ways your brain is telling you all of these things that may not even be real, and they may not even be what you feel, but you keep hearing them. And so I think that exercise or just moving is good when you're in the depths of depression, but also having a connection to something outside of yourself, whatever that is.
I totally, first of all, agree with you, although I'm a therapist and I do talk therapy, so this is how my life runs, and I believe in talk therapy. But I also agree with what you said, which is just talking about something for the heck of talking about it does not necessarily create treatment or getting you out of it. Sometimes it's like re-traumatizing yourself all over again, because you go into that space and you keep saying it. And then when you keep saying it to other people, sometimes your friends and family mirror the same thing constantly back to you and expect you to be that way, so you keep the same sense automatically. Like you talk about your depression, the whole world thinks you're depressed, and they treat you like you're depressed, and then the way they treat you like you're depressed, you keep going back into the same zone. So talking as far as getting it out because you're venting, and if you're venting, if it feels better to you, great. And there's a difference between a female and a male brain, where females usually feel better after they talk about some sort of a drama. Male brain just does not have that. They re-traumatize themselves sometimes, and they get more upset when they go into upset when they talk. So talking about their emotions, it has to have a path and a goal for it to release and then move on. And just, as you said, just kind of like rehashing everything and continuously talking about like drama sharing gets you back into the drama and kind of enrolls everybody else around you in some sort of a drama, rather than having the support system to move you beyond this drama into succeeding in your life and creating a fulfilled life.
Absolutely. I mean, how many people do we know who will talk about the same problem and repeat the same pattern for decades? You're not talking about just like once or twice. They're in the same relationship. They break up, but they find the same pattern. Or they're repeating the same behavior again and again. And they'll talk to you about it endlessly. They'll call you at any time of the day and tell you everything that's going on, but they're not changing it. And so there is that different action, which I completely agree with. I think it's a strong point.
Now, psychosis. Sometimes horrifying. When you are in psychosis, how do you hold on? How do you grasp to some sort of a reality in the midst of all the non-reality tricking of the brain that is happening? Or is it, again, just kind of like hanging in there until it passes?
Yeah. Psychosis is probably one of the scariest things I've ever experienced. It's one of the hardest things I've ever gone through. And it started for me when I was 17, and I would hear voices, and then I'd hear sentences, and then I'd hear...
What would the voices say?
At first, it was just my name. I'd hear my name, I'd turn around, nobody was there. I'd hear my name, turn around, nobody was there. And then it was, voices telling me to kill myself, or voices telling me to kill my friends, or kill my family. And then I started having the hallucinations of people chasing me, or walking past me, or waking me up in my room but not really being there, or popping up in the rearview mirror of my car. And I think what's hard about psychosis is, of all of the things that are embarrassing, hearing voices and seeing things has to be so high on that list. It's hard because people don't know what to do. They're very afraid of it. They don't know how to respond to it, and you're scared to death. The breakthrough I had with psychosis that's helped me forever was one night I went to see a horror movie, and this was some years ago. And for whatever reason, the theater was all black. The sounds were really loud, but everything that was happening in that movie was also just triggering my old hallucinations. The voices, the movements, everything. And so when I left that movie theater, I was triggered back into a really strong psychotic episode. And so what that looked like for me was everything just seems threatening and out of place. So even as people come up to you on the street, their faces seem angry. They're clearly not. Cars that are driving by slowly seem to be like they're after you. I remember like a stop sign feeling like it was tilting at me. And I got in my car to drive home, and I couldn't, and I called an ex-girlfriend of mine at the time, which was my girlfriend at the time, and started explaining what was happening. And throughout my entire life with psychosis, people would always ask me, well, what have you seen? What have you heard? How long was it? Where was it? What happened? And no one ever asked me how I felt about it. And in the midst of crying about the paralysis of not even being able to drive my car, I started talking about how stupid I felt and how ashamed I was and how hard it was for me to not be able to control this thing. And as I was talking about how it made me feel, I felt my anxiety come down. Because instead of focusing on everything I couldn't control, I was focusing on the feelings about it that I could control. And as my anxiety came down, obviously I think part of psychosis can also be having a full-blown panic attack.
Yes.
And as my anxiety came down and the panic came down, things became a little bit clearer for me to the point where I was able to drive home. But what I learned that night was, if I'm ever having hallucinations or delusions of any kind, think about the anxiety I'm experiencing. Think about the nervousness I'm experiencing and work on that. And so now, even if I have a small hallucination, I don't have it as severe as I used to, but if I have a flash or a small hallucination, like someone walking or I hear my name, I don't return to the place of, let me talk about everything I'm seeing and hearing.
Right.
I go to the place of, let me talk about how it feels and lessen my anxiety so that it doesn't hopefully build to that point. And it still can, but it gives you a different level of awareness and it gives you a different level of yourself where you're not repeating that cycle of, this is the worst thing that could happen to me. I have no control over this. There's nothing I can do. It gives you some power to say, okay, this is happening. What can I do about it?
One of my own experiences, just to share with you and the audience, is I've worked with in mental hospitals for many, many years. And when I've actually been working, I used to see people when they were in full psychosis when they came in. So I was with them when they were completely in the psychosis. And there were two people who I knew personally for a long time. And one of them was in full psychosis when I saw him in the hospital. And it was a very different experience of knowing and looking at someone's eyes when you know them and you have such a connection with them. And then suddenly in the full psychosis, those eyes are gone. They're completely responding to something else. But the most, I think, emotional experience I went through was sitting with someone who, for the first time in their life, they were going inside hallucination right as I was sitting with them. This was the first time I ever experienced, which it came in spurts. It wasn't like, okay, I'm already in the room and they're already in psychosis. It came in spurts. And my own experience was really shocking to me, which it was sitting and then their eyes would go away knowing that they're responding to something else. And I couldn't do anything. It was like, for me, as also a practitioner, was feeling very powerless at that moment. That it's almost like you see a loved one going and you want to get them back and they're gone. And the goneness, you saw it with their eyes that it just went away somewhere responding to something else, and then it would come back and respond to this reality, would get to know you and go through that, and then go back and look at you like you were the devil sitting in front of them. And this concept of going into it until they were fully in psychosis for about 6 or 7 days, and then, you know, through medical management they were calming down again. It was interesting because it gave me both aspects of not only what the person is going through internally, but also what the people around them, as friends and family, go through as they're watching someone who they love no longer be the person they know to be.
Yeah.
So there's also a part of the person who's going through an experience, and then an experience of all the people who are around them. So we're going to be right back, and we're going to talk about some of your experience and what you want to say also to the family members who you've probably spoken to, because I know you've spoken to almost, you know, more than 1 million people.
Yes.
And you have also their experience to share with us.
Absolutely. Yeah.
So we'll be right back.
خرد زندگی، مجموعه‌ای از سیدی‌های صوتی که شما رو به اعماق وجود خودتون میبره تا آرامش درون، خواب آسوده، رهایی از احساساتی که شما رو آزار میده و با بدن خودتون متصل میکنه، به زبان فارسی و انگلیسی. این مجموعه با صدای دکتر فوژان زینی شما رو هیپنوتیزم میکنه و کلمات تلقینی به کار رفته میشه تا شما رو سریعتر به اهداف خودتون برسونه، با موسیقی که به شما آرامش میده و با تکنیک مانو بیت. برای سفارش این سیدی های صوتی با دکتر فوژان زینی در تارنمای foojan.com